Good morning, Chris Ohl, infectious diseases, Wake Forest School of Medicine, here in Winston-Salem, North Carolina. Special shout out and hello to all our colleagues and friends down in Charlotte, who I guess are tuning in today. Happy to have you. I really hope everyone had a nice Thanksgiving. The Moravian Star I see is up, and it was lit last night on top of our medical center here in Winston. And that means the holiday season is in full swing, and we can talk a little bit about holiday activities with COVID and the Omicron variant. So how are we doing? Over the last 2 weeks, our cases up here in the Triad and also down in Mecklenburg County have been relatively stable. Here in Winston, we're at 21 per 100,000 per day, and that's about what it was 2 to 3 weeks ago. So it seems to have plateaued a bit with the recent increase in cases. In Guilford County, it's at 16 per 100,000 per day, and in Mecklenburg County, it's at 16 per 100,000 per day. Anything less than 20 is kind of comfortable. Less than 10 would be optimal. So we have a little ways to go yet. What's going to happen in the next few weeks? Well, we'll have to wait and see what happens as a result of Thanksgiving travel and Thanksgiving get-together. It's a little bit too early to know today because the incubation period for the Delta variant's roughly 3 to 4 days, and it then has to get tested and then get into the system. So by early next week, we should know a little bit about what Thanksgiving meant to us. My predictions so far have been mostly accurate. Our cases went down from our big peak in September. Didn't go down quite as far as they would, or for as long as I thought they would, but I'm happy to see that the increase in cases that started about 2.5 weeks ago has plateaued a little bit. I think that the cases will still increase again, and we'll have to see how far and how high. I still think it's going to be nowhere near what it was last year. In fact, last year at this time, we were starting to struggle with COVID, if you remember. But there'll also be some other viruses circulating around. Flu has reared its head. We're seeing cases here now in the Triad. We're seeing cases down in the Charlotte area. And so if you haven't got your flu shot, you need to do that. We'll talk about COVID boosters and vaccines in a minute, but don't forget about the flu shot. There'll also be some other viruses going around. RSV is still hanging in there, and particularly for our children. And we've been seeing some hospitalizations due to RSV in our young kids up here in the Triad. The schools and universities still largely doing fairly well. Interesting, I saw some data last Tuesday from our Winston-Salem, Forsyth County schools, that if you compare our rates of quarantine and virtual learning because of COVID exposure or COVID infection between here in Forsyth County and down in Union County, and even to some extent in Davie County, we're doing a lot better. In fact, about maybe a third of the absenteeism due to having to quarantine due to a COVID exposure here in Forsyth County. Why is that? Largely because we're still wearing our masks here in Forsyth County, where Union County and Davie County no longer are. So a big applause from me to the Winston-Salem Forsyth County schools. At their school board meeting Tuesday, they voted to extend the mask mandate for about another 2 weeks, and then we're going to vote again. So it's like every 2 weeks we reassess, and that's the way to do it. So interesting that in the public comment period during that school board meeting, I heard some things that just frankly aren't true, so I want to call that out. One is that masks cause nosebleeds. No, they do not. In fact, the humidity provided by a mask actually would make it less likely that a child or an adult would have a nosebleed. The other, that masks are beginning to harm our children. You know, if you think that masks are deleterious to health, maybe you should go find a surgeon and talk to them. These guys and gals wear masks all day in their work and have been doing so for about 100 years. And really, it's to protect our patients and to protect other people. No different than masking in a school. The university's still doing well. I have my fingers crossed and a lot of hope for Wake Forest University playing in the ACC tournament down in Charlotte. If you're going to the ACC tournament, and there will be a lot of Wake Forest students there, I hear, then mask up during indoor quarantining. When you're outside, probably don't need the mask. Dress warm. And I think you can use a lot of hand sanitizer, bring some along, and the usual stuff will help protect us. The Wake Forest University students are largely about 99% vaccinated, so they're going down there with some protection from vaccines as well. So I wish them luck, and hopefully maybe an Orange Bowl in the future. We'll have to see. So the big news of the week is Omicron variant. First of all, what happened to the other two Greek letters of the alphabet, which are mu and nu? The WHO decided to skip those because a new variant sounds like a new as in not old, rather than the Greek letter nu. So they just went straight to Omicron. By the way, the next one will be Omega, if you're counting. It seems like a hurricane season, doesn't it? So the Omicron variant, we still got a lot to figure out about this. Some things that people probably haven't heard yet that I have gotten from talking with my colleagues here in the infectious disease community who have been in contact with our infectious disease contacts and people in South Africa, is this variant probably came from an immunocompromised patient, one specific immunocompromised patient who couldn't clear the virus despite treatments and monoclonal antibodies. And that person had at least 200 days straight of being test positive for COVID. And so when you have such a long duration of viremia and viral replication, and you're hitting it particularly with monoclonal antibodies, you can then select out variant mutations that then can add up fairly quickly, and it looks like that's what happens. So this variant's got over 30, probably close to 50 total mutations, around 15 of them in the receptor binding region. The receptor binding region is the important place to look at because this is where the virus attaches to our body, particularly our respiratory cells in our nose, in the back of the throat, and to some extent in the lungs. So that we know. We also know that this variant's probably been around longer than Thanksgiving, which was when it first hit the media. In fact, it probably goes back into early November. I wouldn't be surprised if we don't find cases into October. And that by the time everyone freaked out and put in their travel bans, the variant had pretty much expanded around the world, and including to here in the United States. We now have a case in California from somebody who traveled to South Africa. So it kind of goes to show you that international travel bans can maybe slow down spread of a virus, blunt it a little bit, but it's not going to prevent it, and they're probably not necessary. Here are some of the open questions, and then I'll offer my thoughts on each of these. One, is Omicron more transmissible? Yeah, probably. Judging by the rate of increase of infections in South Africa right now, which is almost doubling every day. Yeah, it probably is more transmissible. The question still remains, more transmissible than what? More transmissible than the wild type? Yeah, I think so. More transmissible than beta, which is the variant that South Africa has been dealing with over the last few months? Probably. It looks like it is. More transmissible than delta? I don't know. Maybe, maybe not. So if what's going to happen is over the next few weeks as we watch this, we'll have to see how this battle of supervillains between Omicron and Delta work out. It's almost like a Marvel movie, which for the holidays I guess is appropriate. So if Omicron turns out to have more transmission fitness because of its mutations than Delta, then Omicron will become the dominant variant. And it will become dominant here in the United States at some point. If Delta has more transmission fitness and wins the fight, then it'll still remain the dominant variant. So we'll have to see how all that works out. Right now, we don't really have any information about Omicron versus Delta. Does Omicron cause more severe disease or infection? Early data suggests no, actually. And in fact, the symptoms look like it's about the same. Sore throat, runny nose, fever, aches, and cough, and for most people. The people who are at high risk of severe infection, it seems to be the same as it's been for coronavirus here all along. Those with underlying health problems and those who are older. There actually could be, possibly, maybe, if you're a glass half full person, that it might actually be a little less severe. And that might actually be something that could be welcome, because if Omicron comes around and is more transmissible and affects more people but really isn't all that severe, then people get immune through a cold rather than through hospitalization, serious infection, and possibly death. So we'll have to see, but early data suggests that it's really not any more severe. Do vaccines work against it? Well, we don't know for sure. My prediction is that vaccines will not be totally wiped out by Omicron in effectiveness. And there's actually some data to suggest that my thoughts might be true. For instance, in South Africa right now, while the number of cases of Omicron are increasing and doubling almost every day, the number of hospitalizations are not. And largely, almost all of the people who've been admitted to the hospital with Omicron in South Africa have been unvaccinated. So just like with Delta here in the United States, as we were telling you through September and October, where 95%, 97% of people being admitted to the hospital were unvaccinated people, it looks like that's the same with Omicron in South Africa. That's a little bit encouraging. And suggests that there's at least some protection from the vaccine, particularly for severe disease and for hospitalization and death. Will the vaccines be still a total shield against Omicron? Well, they weren't for Delta. We've been dealing with breakthrough infections in vaccinated people, as forth the recommendations to get a booster. But those are largely what I've been calling COVID colds. Runny nose, sore throat, fever, chills last a few days. Maybe keep you out of work. And if you test positive, then keep you out of work and school for 10 days because you'll be in isolation. But largely it's just a bad cold. And we'll have to see with Omicron how many breakthrough infections occur in previously vaccinated people. But I think that it'll be somewhat like Delta, actually. Next question is that what about a new vaccine? So actually, the companies that make these vaccines are already working on an Omicron-specific vaccine. They can do so because they have the sequence of the virus, and it would take about 3-4 months for it to get out and get through an approval process. If we need the vaccine, it'll then be available. This was done with the Delta variant as well, but we didn't develop and market and put out there a Delta variant specific vaccine because the vaccines were still protecting against severe disease and hospitalization against the Delta variant. So we just hung on to that vaccine, haven't used it yet. So we're going to do the same with Omicron. If it looks like vaccine effectiveness is diminished enough, then that vaccine will roll out in the spring and we'll have an option to get vaccinated against that. First of all, we'll have to see how big of a problem it becomes here in the United States. How about treatments? Well, the treatments that we use for Omicron or for Delta and other variants are largely right now remdesivir and hospitalized patients and monoclonal antibodies for outpatients, particularly in people who are at higher risk for serious effects from infection. There is some concern, and I agree, it really is a concern, that monoclonal antibodies won't be as effective against Omicron. In fact, I'd be very surprised if they are. And so the companies are now developing Omicron-specific monoclonal antibodies, so we'll have those available to us, I think, in the spring. Remdesivir will be just as effective, I think, against Omicron as it is against Delta and the wild-type virus. What about new treatments? Molnupiravir and Pfizer's Paxlovid, I think, will be just as effective against Omicron. That would be my hypothesis. Have to check to make sure, and the companies are looking at that right now. But because these work in a total different way against where the mutations in Omicron are, I think they'll still be effective. And we'll talk a little bit more about molnupiravir in a minute. So that's a little bit about Omicron. I think it'll take a couple more weeks before we'll know more. I'm not panicking. I'm sleeping just as well now as I did before Thanksgiving. I don't think, I think this will be something like Delta. So maybe the worst case scenario for us is that we'll have another Delta wave, but we have a lot more people now who are immune. We have more people who are vaccinated, and I think it'll blunt the effect. What should you do now with Omicron in the picture? First of all, I think that right now we don't know of any cases here in North Carolina, and we're actually actively sequencing a lot of COVID virus in North Carolina now. There's a program that's led by NC State and funded through the state and with grants. I'm sorry, with UNC, not NC State. But it's a partnership with laboratories throughout the state. Here in Atrium Health, all of the isolates that are collected for COVID are randomly then sorted, and then a few of those are selected to sequence. And those are sent up here to Winston. So the laboratory that's doing that is with Atrium Health, Wake Forest Baptist. So we will know. Now, if you get COVID in the next few weeks, should you have your isolate sequenced? No, because for you, it probably, as an individual, it doesn't make any difference. This is something we use for public health and for epidemiology. So you can't go to your doctor and ask them to test you for Omicron. So we can't. That's just not something that's worthwhile, and it won't be done. but that sequencing isn't occurring. So far we haven't seen anything here in North Carolina. We've had one case in the country. So it'll probably take a while for Omicron to develop and spread. If it wins the war or the battle against Delta and the supervillain battle, it'll take 3 or 4 months for it to get here. That's about how long Delta took. So we have some time. So right now and for the holiday season, let's do what we were doing before. When you're traveling, mask up. When you're going to visit relatives and friends and before travel, besides wearing a mask during your travel, you can get tested. And just announced again this morning that at-home tests for COVID are now going to be released for free. I don't know how long that will take, but that will be out. And so, and then access should be a lot better and availability be higher. So let's say it's December 23rd, you're going to visit Grandma for Christmas, and you're taking the family, and get yourself tested before you go, and make sure that way you can increase your protection for Grandma. If you're really worried about transmission, Grandma's got some underlying health problems and such, you wear a mask while you're there. So I don't think we have to change our holiday travel plans. What did I not say about part of your holiday planning and travel is to get vaccinated. I left that for last because everybody needs to get vaccinated. This is the best thing that you can do. Even if Omicron becomes our dominant variant, being vaccinated is the best way to protect yourself for it. As I told you earlier, early data is showing that vaccine still protects against serious infection and death. And hopefully that holds up as time goes on. So get vaccinated. If you have been vaccinated, go get boosted. Who should get boosted? It's a lot easier now. If you're over 18, get boosted. Just do it. It increases the level of immunity, and it increases the breadth of different antibodies. And it looks like that's going to even shore up vaccines much more for Omicron compared to not being boosted. Particularly, let's get boosted before the holidays, before we start going to our parties and socializing and traveling. Let's get that in. College students, you guys need to get boosted now. And you definitely need to do it before the start of your spring semester, because you'll be coming back to school during the height of respiratory viral season. So everybody, let's get boosted. Question has come up as to whether we should wait to get an Omicron-specific vaccine. My suggestion would be no, don't wait. Go out and get your vaccination if you haven't been vaccinated yet. Get your 2 shots of one of the messenger RNA vaccines, and or Johnson & Johnson if that's what appeals to you. I would recommend the messenger RNA vaccines. And then get a booster. And I would not wait for an Omicron-specific vaccine, because first of all, we may not need it. It may not even become out. So I wouldn't wait. International travel has gotten a lot more complicated in the last week. So if you were planning a trip to Europe over the holidays, safari in Africa, potentially going to Thailand, so on and so forth, a lot of these countries have begun opening up their borders. Many of them have re-shut down their borders now that Omicron is out. And so you really need to look at what you're trying to do and where you're trying to do it. Do you have to cancel your international travel plans? No. Just be more careful about it and really be cognizant of the testing that you may need to go in and the quarantine requirements that might occur. A 2-week trip to London doesn't make much sense if you have to spend 2 weeks in quarantine after your arrival. So it's unfortunate. Hang in there, though. A lot of this is being sorted out, and I think in the next few weeks, couple months, we'll have, I think it'll open back up some again. Be wary that testing, if you travel internationally, that testing requirements to come into the United States will have changed. They're going to change in the very near future. It used to be you needed a test within 72 hours. The new requirement will be you have to be tested within 24 hours. And that really crinks the logistics, and so you may have to spend your last free day before getting on the airplane going to get your COVID test rather than going to see the Eiffel Tower. So plan your vacation accordingly. What options do we have for testing if you want to test and you're asymptomatic? You can go to a retail pharmacy. There are some urgent cares that provide it. Here in Winston, there is an every other day availability for testing with Novant Health, and some private physicians who have it available will offer it. Or you can get an at-home test from and buy it from one of your pharmacies or over Amazon or one of the other mail order places. The home tests are a little less sensitive than the other PCR tests, but for most things, like going to visit grandma, they're good enough. So how are we doing in vaccinations here in our region? So here in Forsyth County, about 58% of all ages are vaccinated, and about 68% of people over the 18 are vaccinated. So it's still steadily climbing. It's really not much different in Mecklenburg. I think it's 1% difference for each, and that's it. So these Forsyth and Mecklenburg are in the top tier of counties in North Carolina as far as getting people vaccinated. If you go down to the Mecklenburg area and you go to Union County or a little bit to the west, some of the other counties there, vaccination rates are lower. Up here in the Triad, the more west and north you go, the lower your vaccination rates get. And interestingly, it still correlates with rates of infection. I told you here in Forsyth County we're at 21. If you go up to Wilkes, I think it was 36. Stokes was up in the 40s. Was it Stokes or Surrey? So the lower the vaccination rate in the county, the higher your COVID rates are going to be. And that'll be the same with Omicron as it is with the other variants. I'm a little bit disappointed lately about the court rulings for vaccine mandates, and there have been several states now who've challenged the federal vaccine mandate, and the courts have upheld that challenge. And so if you get hospitalized in Utah right now, you got a pretty good chance that the doctor or nurse taking care of you has not been vaccinated. But if you get hospitalized here in North Carolina, you got a pretty good chance that that doctor or nurse has, particularly up here in the Triad or down in the Charlotte area, because we have our vaccine mandates. As controversial as they are, vaccine mandates work. And when you get a large enough part of a population vaccinated, viral transmission drops considerably. Best example is Wake Forest University. We've had about 120 cases of COVID over the entire semester, and that compared to the thousands that we had last year per semester. In fact, we've had 140 cases of flu at Wake Forest University, so there have been more cases of flu than COVID. It's a highly vaccinated population, and it was a mandate that got it that way. And so mandates work. I know they're controversial. People don't like doing things that they want to have control, they want their freedom. But in order for us to have freedom, real true freedom and live the way we want to live and do the things we want to do without limitations and without masks. Could be in the very near future, actually, if everyone went out and get vaccinated. I mean, it just makes sense to me. That's freedom. So, holiday gatherings and parties is the last thing on here. I think we talked about it a little bit. I think it's okay. Family gatherings, certainly. Best thing you can do is have a gathering of all vaccinated people. So if you're going to have a holiday party, invite the neighbors. If everyone's vaccinated, it's going to be a pretty safe party. If not, wear a mask, take it outside, get the patio heater out, and serve the food outside, wear a mask inside. And I think you'll be fine. It'll be fun. We'll have to see how Santa helpers deal with the things this year. A Santa helper has obviously got a lot of close contact with people, and so I think you might see that curtailed some this year. But we'll have to see. So, Santa Claus himself, he has no worries. I heard he's vaccinated. So, with that, any other questions from the group?
We had a question about, will there ever be a point where titer tests are available to the public, or titers, like antibody testing?
Oh, will there ever be a point if antibody testing is available to the public? Well, I mean, technically it already is through a physician. It really doesn't, it still doesn't really tell you that much, actually. Because I can tell you, and I'll tell you, and I didn't mention it earlier, with Omicron specifically, we are seeing breakthrough infections in people who have been previously infected with COVID. But not so much yet with the vaccine. So the vaccine-induced immunity is better than natural immunity. So that positive antibody test doesn't really tell you about the directness or the breadth of your immunity. Even if it was positive, I'm still going to recommend you get a booster if you've been vaccinated, or get the full vaccination series if you haven't been vaccinated. Test is negative, I'm going to tell you that. So it doesn't really help us much. We're getting pretty close to knowing what the population-based cutoff for positive and negative are, but we still don't know yet. What level's positive? It's still kind of unclear. So I don't think antibody testing is all that useful. For me and my patients and the people that I see, this is the number of times I've ordered an antibody test form, unless they're heavily immunocompromised or a bone marrow transplant.
And then someone asked about FDA, like full approval on Moderna. Has there been any word on that? Because it's still emergency use, right?
Yeah, so I don't know where the FDA approval process of Moderna is. Yes, it's still as an EUA. That's gotten kind of complicated because even with Pfizer's vaccine, for over 18, it's approved. Under 18 or 16. I think it may be under 16. It's still an EUA. The booster is still an EUA. The full vaccination series not. So it's gotten a little bit confusing. But I don't know. Moderna's, I know, is in the process. I mean, the FDA has been kind of busy lately. The other thing I said that I'd talk about, which I didn't, and then I forgot to, was on molnupiravir, the oral drug that works against SARS-CoV-2. So that got an FDA approval this week, although I can tell you the committee was less than enthused about it. And after having seen newer data about it, and I'm not as enthused about it either. So initially we thought it conferred a 50% protection for people who had a high risk for COVID if treated in the first 5 days. Now it looks like it's only a 30% reduction in hospitalization, and it goes from, in the study, from 10% down to about 7 to 8%. So that's not huge. And The other thing, the way the drug works means that if you're pregnant or breastfeeding, you won't be able to take it until we have more safety data. And I don't think it's going to be the game changer that I initially thought it was going to be. It still is good to have. It'll likely work against Omicron. It's a pill. You can get it from a pharmacy. Imagine the EUA that comes out from the FDA. You'll say only high-risk people should take it, where the benefit clearly outweighs the risk. So Pfizer's drug, we'll have to see. Vaxitol, that's an oral drug as well. You have to take it within the first few days again of your infection. That one probably looks a little bit more promising. Works totally different than molnupiravir does. And the actual components of it are very close to drugs that we're already using for other viruses. So I'm pretty confident about its safety.
And the last question was, someone wanted to know why you would recommend the mRNA over the J&J.
Yeah, so why do I recommend the mRNA over the J&J vaccine? Because because they work better. Their immunity, the induced immunity from them lasts longer and is more robust. If you're going to do J&J, you need to have 2 shots separated by 2 months. So it's okay. I mean, if that's what the vaccine you want, then make sure you get 2 shots from it. All right. I think we'll do another one next week, and let's go out and get our holiday shopping done.